Hello, everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. How are you today, Greg?
Fantastic.
Well, another 15 minutes of packed information. Are you ready to go?
The pressure you put on me is a lot, but let's go for it.
So today I want to talk about the pellet, obviously. Optimal Bio obviously does BHRT, so Bioidentical Hormone Replacement Therapy, exclusively using the bioidentical pellet.
That's key.
Testosterone pellet. Mm-hmm. However, we also do treat with estrogen as well.
Yeah, 100%.
So let's talk about estrogen.
Yeah, this is important. There are three sex hormones. There's testosterone, estrogen, and progesterone. And in men, we get estrogen from our testosterone. It converts over. Same in women, but it's very important. So men, we replace only the testosterone. And the reason we replace testosterone is because it's the most abundant active hormone in the human body, not just the man, in the human body. So in women, we do the same thing. We have pellets for testosterone. But there's a certain part of women's life span where they stop making estrogen as well. And we have a pellet for estrogen as well. And we'll go over today the details of all that, and how much estrogen you give, what parameter to use, and what for. And then also progesterone. But progesterone is interesting. The whole idea of the route of the pellet is to bypass the liver. So that's why testosterone and estrogen is given subcutaneously to bypass the liver. It's called the first liver bypass effect. Great. Why don't you do progesterone that way? Because we want progesterone in the liver. Take it orally. It actually converts to a molecule called 5-allopregnanolol, which actually is a neurosteroid that helps you sleep and protect the brain. So that's why the route of what you do is very, very important. And obviously the structure. So we spent a lot of time on testosterone over the years, but never strictly on estrogen. And I think a few minutes on estrogen, we'll go over that benefit today.
So from a female life perspective, when do they stop making estrogen?
It's very interesting. There's two major organs that make estrogen. Well, three, I'll go in a second, but the ovary and the adrenal glands. And so in their reproductive cycle, say 14 to say 40, 45, it's made by the ovary primarily. Other than that, it's made by the adrenal glands. Now, what's important, there are three types of estrogens: E1, E2, E3. E1 is made by mainly fat cells and fat cells. E2 is made primarily for the ovary and some of the adrenals, and 3 is made by actually from the placenta for when the baby's being pregnant. It's actually the E4 made by the baby inside the womb from the liver. But these are the estrogens. Okay. They have two receptors, an alpha and a beta receptor. I'm trying to make it simple to an alpha receptors is they're proteins are made out of amino acids linked together, and the alpha receptor and the beta receptor share 59% of the same amino acids. But when they change the structure, change how these called ligands, how they bind things. And there's alpha and there's beta. In simple terms, alpha is more proliferative of growth, and I'd say beta counteracts that. Okay. And that's important on the breast tissue, the uterus, men's prostates. And there's a lot of benefits for estrogen in both. So in our body, testosterone converts to estrogen, estradiol. Estradiol is the most potent one, but also the one that's made in that reproductive age. And then there's three pathways for this estrogen to leave your body. 2, 16, and 4, these pathways, okay? 2 is the best pathway because that's the beta or it's neutral. The other 2 are alphas, so you don't want to go that pathway. So it's how the body has this circulatory system. But all that being said, what we want to do is we replace estrogen. We want to replace the estradiol in a physiological amount that does the benefits that it does. And I have a whole system on that, but we know that estrogen protects the heart, the nervous system, the brain, and the breast tissue needs this. Prostate doesn't. So there's these protections to make sure you protect if it's either an alpha or a beta. But it's very important to understand that you want the same exact structure. So therefore the body can utilize and metabolize it so that you don't get the side effects. Because when you read literature on estrogen replacement therapy, they say it's great, but there's side effects, i.e. breast cancer or blood clots. But no, that they throw the category, Jim. They use the synthetic made ones that have a different structure in that category. When you look simply at the one the body makes, it does not increase. In fact, it decreases those aspects because these hormones your body makes, so they're protective.
So from a simple perspective, are the synthetics not balancing the alpha with the beta?
They're actually more, two things with them. First off is the route. They go to the liver, and I'll go over that in a minute. So when you go to the liver, estrogen makes your liver make more clotting proteins. That's why blood clots are more prevalent from oral estrogen,
Which are birth control pills?
Birth control pills. There is a oral estrogen. Well, I'm going to go over the ingredients in a minute. It'll blow your mind. They call it natural. So the route's important. Yeah, the route's important, and the amount of that is important, and the structure is important. So the pellet is pure hormone, pure estradiol. And the binding agent is a natural fat, about 2% of it, which is either cholesterol or stearic acid, which are natural. Your body recognizes that. And that's what's important, because when your body recognizes it, it knows what to do with it. That's the whole problem. That. And when you take estradiol away from the mouth and take it subcutaneously, you bypass the blood clots. You bypass the side effects that could happen. And that's very interesting is in our body, in the breast tissue, back to the receptors again, E1, E2, E3 has these two receptors, alpha and beta. E1 is 5-to-1 alpha, more growth. E3 is 1-to-3, 1-to-3 beta, so there's more negative growth. This is from the placenta, makes sense. The E2, the more potent one, is actually neutral, doesn't affect beta or alpha. It's neutral to both. And that's it's more protective. Actually, in the breast tissue, it actually downregulates its own receptor sites and increases progesterone receptor sites, which are negating growth again. And on top of all of that, there are more testosterone receptors in breast tissue than there are estrogen receptors. And breast cancer, Dr. Glazer's studies show she has a decrease in breast cancer of 40 to 60% in women who take, she only gets testosterone pellets. So the body cannot make a structure that would actually hurt you. In fact, when you look at the nervous system, estradiol protects from Alzheimer's, the tau proteins. It protects, this is great. In the endothelial lining, there was a study at Harvard about 3-4 years ago. You start to have hot flashes. There's a 200% increase in heart attack. But what is that? How does that go to get a hot flash heart attack? It's not the heart attack it's caused by the heart flashes. It's that heart attack there's cardioprotection from the estrogen. And one of the things the estrogen does, besides making your thermoregulatory system healthier, it keeps the endothelial lining of your arteries healthy. So when that decreases, what's the sign? Oh, that's a red flag. Because I'm getting hot flashes. That means your lining is becoming dysfunctional. So it's all just ties together, Jim.
Interesting. So the synthetic estrogen, better yet, let's move on from there. So typical patient comes in. She's postmenopausal. Mm-hmm. Let's say she's 56 to 60 years old. Mm-hmm. From the pure application of the pellet, how many testosterones, ballpark, and how many estrogen pellets is that?
That'd be one of each, but the dose would be different. The average testosterone level would be about 100, 125 milligrams. The average estrogen, based upon whether algorithm and Y, is say between 6 and 12.5. There's some phenomenal doctors I respect. Dr. Glazer is fantastic. Dr. Mark Richards, they recommend no estrogen because there's conversion of testosterone to estrogen. I was a gynecologist. There's definitely a difference to the postmenopausal's private parts when you get a little bit of estrogen. I don't go too high. There's a happy range. What range do I use? The brain makes a thing called FSH, follicle stimulating hormone. And that hormone is stimulated by estrogen. Estradiol is basically a metabolite of testosterone. Testosterone is formed first that converts to estradiol. Now, FSH in the brain will tell the ovary to make the egg and have released the estrogen. When that stops working, the ovary stops working, the brain does not know that. It still tries to turn the ovary on. So instead of having an FSH to say 3 or 4, it gets to 25, 26, and even over 100, trying to kick it on. The higher that FSH is, the more symptoms you get. Vaginal dryness, hot flashing. And inside your body, less bone formation, less muscle formation, less brain formation, remember, E1 dominates in postmenopause. They're more of an alpha receptor. You want the E2 to dominate, which helps protect the breast. So Jim, the thing about that is you want to replace those numbers, and I use the number of 23. 23 is the number, and over that is menopause. So I give enough estrogen to lower that under 20. Okay. That's the goal. And then for the testosterone, we have the range. When I was in school, a woman's range was roughly 90 to say 250, 300. And we've multiple podcasts on that on why it's so abnormal. But I try to get those healthy 25-year-old ranges. I'm trying to keep a youthful chemistry. You would never tell a person they're too old for insulin. Same thing with these hormones.
So maybe you can answer this question. I'm not sure, but I could see the benefit of patients coming to Optimal Bio for this type of treatment. But what is that same female, if she's getting a patch or a cream, how did she handle then the
Symptoms?
estrogen piece of it and the symptoms?
Okay,
What are
forget
they
that.
actually going to get?
The first standard of care treatment for a menopausal woman is not a replacement of synthetics. It's antidepressants.
Right.
That's the standard of care.
I understand. But let's say we get beyond the antidepressants.
Okay. So they're going to do a cream, oral. There's an estradiol oral. But again, in the American standard is they don't replace testosterone. That to me is the key. That's the key one. If you're going to add estrogen, how do you add it? If you add it orally, cream, gel, or in the vagina for protection. When you look at these ingredients, I could read some of them, Jim. It's mind-boggling. This is the patch. It has estradiol in it. Then it has acrylic adhesion, silicone adhesion, NF. I have no idea what NF is. Ole alcohol. It has povidone, USP, whatever that is, dipropylene glycol, and a polyester. But the doctors will say, 20 years ago would say, it's a bioidentical patch. What about the other ingredients? You have the gel. It has polyethylene glycol in it. By the way, that's what's in antifreeze. Okay, that's what's important.
Well, you won't freeze to death,
exactly.
right?
In the tablet, you have estradiol, but then you have hydropropylene, you have lactose monodehydrate, you have maize starch, and you have vegetable magnesium stearate. Great. The vaginal one, you have I can't pronounce these things, and I'm
You're a doctor.
It's crazy. But all these other chemicals, but they'll say it's bioidentical because a component is estradiol. No, there's other things to it. What we give is strictly estradiol, and we bypass the risk factors of blood clot. In fact, if you're a woman who has a history of factor V latent, it's a genetic disease that increases blood clots. You can't take oral estrogens because it increases blood clots. You can take this estrogen because it bypasses the liver. That's what's so important is we're mimicking the ovaries. We're mimicking the testicles. And we're releasing it exactly the same way in a steady state that our glands do it. And that's crucial. But the structure, again, when your doctor says this patch is bioidentical, they're wrong. Because I was that doctor. All right. What's the ingredients? How much of that stuff gets in there? Don't know, but it's not bioidentical.
Yeah, I can't even. I mean, if we had time, we can look some of those up to see what
Please,
they are.
they're all on the sheets and they're all there. But Jim, this is the important part. That's why you say that you read the literature of this. There are benefits for this, but there's the risk factors. Well, what causes the risk factors? Well, the different structure of the molecule. It's not the same. The high dose of the molecule, because you have to do it orally to bypass. We have a low dose because we're bypassing the liver. When you take something orally, most of it is degraded by your stomach. We're bypassing all of that. And the key thing about the pellet is the estradiol pellet and the testosterone pellet, it's been used for almost 90 years. 90 years with no recalls in any country ever. It's the most studied pellet, the most studied route, the most studied structure ever. Pharmacy companies can only own a molecule for 17 years. So I think the onus is on them to tell me that their molecule is superior to the one your body makes. Your body would not make a molecule that would kill us. It just couldn't. You look at men. The prostate, I don't think prostate cancer is caused by extra testosterone. If you think about it, 8-year-old boys don't get prostate cancer. It's older. What happens older? When testosterone levels drop because of being exposed to these fake estrogens. There's an enzyme in the prostate. It's a estradiol beta receptor, and that's usually inactive by a high testosterone. The testosterone drops, the estrogen goes up. That's more of the culprit, just the opposite. Dr. Morgenthaler has great papers on that. Dr. Thomas Friedman has a great book called How Testosterone Could Cure Prostate Cancer, talking about this hormonal hypothesis. Because you think about it, these different receptors have different modalities and different aspects of it. So I don't claim that I know all this stuff. All I know is this body, if given the structure it makes not normally at physiological optimal levels, your body knows what to do.
So typical patient, again, 57-year-old postmenopausal, menopausal in this case, hot flashes, et cetera, et cetera. She comes in, she gets treated.
Yep.
Expectation-wise, that her symptoms get reduced and she feels better is what, 6 months?
No. We're talking
3 months?
We're talking hours.
That fast?
Hot flashes are within a few hours to a few days. Now, it takes time because this is a transcription protein. Bottom line, it makes proteins.
Right.
So it takes time for the body to burn the fat, change the muscle, make the bone. But we can spend hours on how our skeleton changes every 25% per year. We need to do another podcast on this, on how that affects every system of your body. So I want a youthful chemistry to stay healthy. I don't want sick care. I want preventive care.
Just amazing to me that the pellet that you use literally has 2 ingredients in it, and everything else you described has at least 5 to 7. You can't even pronounce the names.
I took etymology. I don't know. I don't get it, bro. The thing about it is this. Our body is amazingly made. It's given what it needs. The reason why we did abnormal numbers is because of the environment we live in.
As always, 15 minutes of phenomenal information. Thank you, Dr.
Thank
Brannon.
you. I appreciate it.